Hello, this is Dr. Lewerenz, Longevity Health Institute. Hope this finds you well. Hair loss and weight loss, what do they have in common? What can we associate to them and what can we get out of this? So I know it's kind of a weird double topic, but I want to share with you some things because today, patient actually I saw one on follow-up, very, very similar in kind of situations and circumstances and outcomes. So this is really, really key, and I've heard this over and over and over lately post-COVID, and there's reasons for it. But that is, again, hair loss, weight loss, losing hair, which nobody wants to do, but also weight loss, most people want to do and are struggling with, and especially, again, post-COVID. But let's talk just briefly about something with hair loss. So hair loss, very commonly happens to nutrient deficiencies, hormonal irregularities and imbalances, but also blood flow to the scalp, okay, and inflammatory and sometimes even immune reactions to the scalp. Now, when we talk about hair loss, there's genetics, there's male pattern baldness, and what I'm trying to cover with you today is more of when there's a noticeable change in your hair, men or women, where there's a significant shift in the amount of hair you're losing, okay, and essentially your follicles are saying, hey, we give up, we shed, and you're losing more than you're regenerating. Hairs do grow in cycles, so if you get some significant hair loss for any reason, you're going to regenerate that hair naturally about every 3-4 months. So hairs grow in all these different cycles, so it's not like all is shedding at once. But again, if you're losing more than you're gaining, here's some things that you want to think of and you want to have checked out, okay? And that's really, really key because it is treatable, it is fixable no matter what the cause. And especially with women, I want to really stress that, especially with women, because it's a very common association in your mid-30s, potentially even younger, and up, and especially perimenopausal, so mid to late 40s and menopause, okay, and also post-infectious, so post-viral, post-COVID, very common hair loss, okay? In fact, I have a hairdresser here that was here about a month ago and just said to me, he's a patient, and he actually said to me, he goes, hey doc, you seen a lot of hair loss? Are you hearing this? Because he goes, almost every client I have post-COVID, I'm seeing some significant hair loss and they're bringing it up, and I notice it when I'm, working on their hair. And I'm like, absolutely. It's one of the, 3 or 4 or 5 things that are brought up always post-COVID, whether you had mild COVID infection or significant, or severe. So anyway, what are the causes potentially? So one is this you always want to think of. What is going on with you hormonally if you're shedding more hair than you're reproducing? You got to check out your thyroid. Thyroid imbalances are very common with hair loss, very more common in women than in men, but you got to check out your thyroid. The other thing is imbalance in sex hormones. So particularly testosterone, super physiologic effects, meaning imbalances where you're producing a hormone called dihydrotestosterone. And yes, women have testosterone, and women can convert testosterone to dihydrotestosterone. That is 7 times stronger per receptor. So what does that all mean? It means that if you're converting your natural, again, we're not talking about hormone replacement, your natural testosterone to dihydrotestosterone, you're going to tend to shed more hair. Who does this happen in? It happens in women that exercise intensely, potentially even particularly women that exercise using heavy weights because they produce more testosterone. So to weightlifters, CrossFitters, more mass builders, if you will. Not that there's anything wrong with that, but again, if you're experiencing hair loss, you want to get that, checked out, or at least check in with yourself and think about that, okay? Again, you could be getting elevated testosterone, which is not necessarily a bad thing, but if you're converting a lot of that to dihydrotestosterone, you're going to shed hair, okay? The other thing is loss of progesterone. Now, women will always have a dip in their progesterone pre-cycle, so premenstrually, okay? But as you get older, you're going to get those ratios off a lot more. So you're going to lose more progesterone going into month by month, year by year by year, so that if you're in your 30s to 40s to 50s, that ratio has become bigger and bigger and bigger, okay? That ratio differential could be the reason that you're shedding more hair than you're regenerating. So meaning that that minor, even if it's all that be minor loss in progesterone, you might need that checked and even potentially naturally supplemented. We do a lot of bioidentical hormone replacement here. I'm sure if you follow me and follow this channel and my practitioners or see us, you know we do, and we optimize hormones, we balance hormones physiologically, naturally, using bioidenticals. But the point is, when you raise somebody's progesterone to create that estrogen, testosterone, progesterone balance better, they stop losing hair. And as long as there's good blood supply and good nutrients, then hormones are balanced and your hair has good integrity, and you keep it and regenerate it better. Other things to think of. It's going to sound a little esoteric, but heavy metals, toxins. So if you're not detoxifying well, so if you have a fatty liver, if you're not metabolizing through your liver well, conjugating sulfuricating, methylating, etc., then that detoxification process is not happening, and you could be building toxins, okay? But heavy metals in particularly, believe it or not, can kill your root shaft of your hair follicle, and you'll tend to lose hair, okay? Now, when you treat somebody hormonally, and this is what our expertise is, you should have their hormones balanced, okay? And I'm going back to this just because I don't want to miss it. You want to treat their hormones balanced, because if there's any imbalance, okay, you potentially could lose hair, okay? 95% of our patients, whether it's a complaint or not, when we get them on hormones, get them balanced, whether perimenopausal, postmenopausal, a male andropausal, so we're using testosterone and DHEA, that is when we have them balanced, they stop losing hair, potentially could even regenerate hair. Now, peptides, ipamorelin, and testosterone and growth hormone can give you benefits of regenerating hair. Mostly growth hormone and peptides will do that. But again, the key point here is you got to check your hormones if you're losing hair. Now, I brought up COVID and what happens after COVID, and there's a multifactorial reason to this. But one of the main reasons is also another hormonal issue, and that is your adrenal hormones. Your adrenal hormones get hit significantly post-COVID. There's 5 organs that we know that have been found to have live COVID-19 virus in you post-infection. So whether this is, a month later, 3-4 months later, we know that you're harboring virus post-infection, post-symptomatically, okay, in 5 organs. And one of those organs is your adrenal organ, okay? And what we've seen here in the practice is, and it's very common, it's why people have post-COVID fatigue, whether it's a month or whether it's 6 months, but they cannot produce the adequate amount of cortisol and be balanced, okay, from an adrenal standpoint. And obviously this is going to hit you harder the older you are, okay, and your DHEA also takes a hit. That's another adrenal hormone. So you have to get those balanced, get those checked out, okay, by your practitioner. Now, I will tell you 100% that is fixable, okay, and 99% of our patients that are here, even currently, that we've worked on post-COVID, long haulers, etc., we get their adrenals back, boom, they're better, okay? But my point being is that you cannot ignore the adrenal effects, okay? Whether they're minor or they're major, that can also cause hair loss. You fix the adrenal, the hormone component, and the hair will stop falling out and in general come back, okay? So again, get your hormones checked, make sure you're detoxifying well regarding hair loss, make sure that you don't have heavy metals, and then of course, good nutrients. So one of the major, I'll say the top 2 major things that we do here in our practice and have for years and years and years and years is as when we balance hormones and we get nutrient levels up, women regenerate hair, have healthier hair, grows faster, shaft is bigger, fuller, and they report it here and tell us all the time and send us patients. So the point is it matters, right? What matters to most women? Weight, skin, hair, nails too. Okay, but anyway, my teeth, of course, etc. But those are big ones. Hair is a big one, okay? So now, Other thing, obviously, that we do to boost nutrients is IV nutrients here. That's a whole nother topic, but you bypass the gut, you get to tissue, you get to the scalp, you get to the hair follicle, and that will regenerate hair. Now, here's the thing is, if there's genetics here, you got to talk about family. There is some genetic testing you do. If you have like kind of what I have, my grandfather, brother's father, everybody's going bald as we age. Okay, it's an uphill battle. Yes, you can do some things if you have male pattern baldness, but there's pros and cons to that and side effects, and you want to make sure you're making the right choice. There is a medication that was just actually restudied, republished, called Propecia, and they use that in men, mostly, a little bit in women, for male pattern baldness and hair restoration. And this is what I mean about the warning. When it's a major, pretty much a full blockade of dihydrotestosterone, which I was speaking earlier in the video. Okay, when you do that, there's significant reduction in dihydrotestosterone, maybe even down to zero. You will have apathy or depression. And the suicide rates on this, in fact, the study was suggesting there should be a black box warning on that drug because the suicide rate was higher, depression reported significantly higher. I want to say, don't quote me, I want to say it was like 18%, something like that, okay, reported depression. That's high. That means almost 1/4 of the patients that take that develop depression. So you got to be really careful with the medications and you got to make sure you're seeing a qualified physician knows what they're talking about hormonal balance. Okay. The other thing is, like remember I said, and I'm getting to this, hair loss, weight loss. So what is the trend? And of course it's still spring a bit, mostly summer with our 90-degree temps here in Michigan, but I will tell you that everybody wants to lose weight, right? It's not a new thing, Today, somebody that we were talking about some of these things, and there was a little bit of a post-COVID follow-up, yet I've seen him for years, just to make sure that things are going good. And he's down about 20 pounds, and we were just reviewing some stuff, and I kudos to him, congratulate him, because he's actually doing the work you have to do at home, meaning he's, his lifestyle and his exercise and diet and commitment is there, not just on and off and on and off. So he's doing wonderful, but we reviewed some things that I wanted to share with you that really work, because a lot of people are struggling post-COVID, and there's a multitude of reasons for this, but I'm gonna tell you and share with you one that's huge, is that adrenal effect that I mentioned about the hair loss, okay? When you have COVID, you reduce or you hit your adrenal gland, whether that virus is harbored there or not, or whether the theory is that your adrenal gland is in full drive, organs being used or hyper-used, so it's a stress effect on the organ, and the organ burns out post-infection like COVID-19, or probably could happen with any other big significant infection like a pneumonia or shingles or something like that, okay? But when you wipe out somebody's adrenals like that, not only do they get fatigue, but their metabolic rate goes way down, okay? It goes way, way, way down, okay? Because, that's your fight or flight organ. That's your organ of survival. That's your organ of, I call it the gas for the day and the break, so you don't crash, but you actually have a full gas tank, for the day, so you can, have vitality and energy and all that. You want good adrenal function. Well, if you are depleted in those, your metabolic rate is going to go down to hibernating. Why? Because your body physiologically is telling you to sit and to rest and to recover, okay? And the only way you're going to actually get better is by doing that. And so high metabolism isn't on the physiologic order. So point being is, you got to get somebody's adrenal function and get your adrenal function working better post-COVID to actually have a higher metabolism. So one rule of thumb is this: if you're working on weight loss and you're struggling with weight loss and you're really, and it's not making sense to you, get your adrenals checked. Whether you're post-COVID or not, okay, get your adrenals checked. You have to have an optimal adrenal function to have high metabolism, okay? Now, best way to check adrenals, saliva test. But blood, you can get an idea what's going on, but it is something that can easily be diagnosed, and you can be put on a program supplementally, nutritionally, lifestyle stuff to recover, typically in 1 to 3 months. Severe cases might be 6 months, okay? But you got to get that back for health, for wellness, but also for metabolism and weight loss. let me share with you a couple products that we use this spring and summer, and we've used before, but I've been really pushing them, getting encouraging results. The gentleman I spoke of earlier that lost 20 pounds, and he's doing the work in the kitchen, not just in the gym, but fork to mouth is working a lot better too. Okay, but I want to share with you some things I have him on that he said are working great. I've heard this many other times, but you've seen other videos in this for me. We use this Estro Balance. Estro Balance from JD Nutraceuticals is an excellent supplement. I'll tell you in a minute here where you can get this, but it's an excellent supplement to help you metabolize estrogens. Use them in your body, yet estrogens are being harbored in fat and making you accumulate fat and making fat become a bigger cell that then actually traps water, okay? Plus, this is excellent as a natural daily detoxifier that's gentle, so you don't get a lot of negative effects. This has a lot of your cruciferous vegetables in it, extracts like diindolylmethane, plus wasabi, plus calcium D-gluconate, and black pepper extract. These are all excellent things. Sulforaphane from broccoli. These are all excellent things that help you detoxify estrogens, even the bad ones that potentially can cause breast and ovarian and prostate cancer. For weight loss, I will put a man or even a woman on 4 to 6 of these a day for weight loss. 1 or 2 a day is efficient on your daily kind of benefits. But to lose weight, you want high doses of these. There's nothing negative about it. Excellent, it's gentle, but this can really help you become less estrogen dominant. You've seen other videos with me talking about estrogen dominance and weight gain, something you don't want, but Estro Balance, excellent product. I'll tell you on our website where you can get that, and it's out there. The other one is this from Zymogen called Apicurb. We like Apicurb, probably honestly don't use it enough because usually it comes to mind when somebody really has trouble controlling their appetite. And I really believe in, traction, where if you get somebody's appetite and hunger and craving under control, they get traction where, it's a lot easier. Studies show 17 days, you can really make a difference in impacting habits, okay, like in diet. But we use Apicurb. Why? Apicurb's got some excellent aminos in here that actually really help the brain and gut communicate, and help the brain not have the cravings as much. Plus they elevate mood and have some appetite suppression. So we have 5-HTP in here, 5-hydroxytryptophan, and there is phenylalanine, a great mood enhancer, mood stabilizer, as well as an appetite suppression. In fact, some of the tricks that are put in diet drinks on the market that get your brain liking them, all those diet drinks that you drink out there, phenylalanine, it's in there. Tyrosine's in here too, that raises dopamine, which is a good feeling, kind of a focus feeling too. So sometimes we can use Apicurb with focus, but this is a great product to help you lose weight through changing the drive, the hunger, and the overconsumption, okay? So just some side things for weight loss that can really help you. You can get those if you go to Longevity Health Institute .inc. Go to our website. There's a supplement shop. We do have a fulfillment company, Carewell, but if you click on that shop, you can order any of our products that I talk about here on our channel. And please subscribe to us, because I bring you the best in functional, holistic, natural, personalized medicine. But you can find those on there, the Estro Balance and the Apicurb. The password is HEALTH, HEALTH, just to get in there. Otherwise, call our office and we can kind of direct you through it. But we do have drop shipment there, and there's a lot of guidance on that website also. So Longevity Health Institute Inc., or excuse me, Longevity Health Institute Inc.com, sorry, and you go to the supplement shop. But hair loss and weight loss, they do have some connection here, especially post-COVID. Get your hormones checked, make sure they're in balance, okay, especially your adrenals, and some nice things that can help you lose weight here in the coming months and through the summer. This is Dr. Lewerenz. Hope this is informative. If you need our help in any type of functional personalized medicine, me and my practitioners, wonderful, wonderful services to offer you. Get well to thrive and not just survive, and stay healthy, have great longevity. That's what we do here. Be well.